We're gonna start off with just a little bit of like jostling. It's almost like a little bit of a slow vibration to like the diaphragm area, the obliques, the abs, the TVA, and everything else. So rather than just getting in there right away, we're just going to soften it and to sort of like decrease the nervous system because it's charged up, right? So normally I would actually like kind of like jostle for maybe 2 minutes, but I'll just probably do it for about 30 seconds. And then if anything, I want you to just do a little bit of like belly breath. It's just more calm, right? So you just want to like relax your system as much as you can. And if you feel like there's your body's just waving, just let it go. If you start to feel sick because of your hamburger, just let me know.
Right when we started.
And that's about 30 seconds. So if anything, I'm going to have to kind of go through this area. What I want to do is I want to create a little bit of separation in terms of fascially if everything's all kind of gummed up. Because if I'm doing this and it's creating a little bit of tension, it really should feel like this, where it's like, okay, that actually feels really good. Much like if I'm doing this or I'm doing this, it actually feels okay I'm more pliable, right? So if anything, all I want you to do when when you take a deep breath, I want you to think about breathing into your belly, then ribs, because you won't be able to breathe into your belly as much, and then it'll kind of rise. There's always different ways of breathing, but you're going to think about breath in through your stomach, then here, and then mid, and then chest, and then when you breathe out, think about lowering your stomach, bringing in your ribs, and then the rest is up top. Okay, inhale for me, good, and then exhale. So then, as I'm doing this, I'm actually creating a fascial pull down to your opposite hip, the same area where you might have. So we're doing a little bit of muscle approximation. Okay, inhale again. As you do that, I'm actually going to create a little bit of drag. Exhale, and then I'm going to push down a little bit more. You okay with that? It's not too much. Okay. Inhale again, and then exhale. Inhale again. So then that release creates a little bit of a more of a release. So if I were to go back into the area, is that still tender at all? No? Okay. Do you have tenderness up here at all? Okay. So all I'm doing is I'm just creating a little bit of a separation without trying to create a lot of pain. Yeah. Because sometimes we have a little bit more tension in this area, either lymphatically or tissue wise, fascially. So we just want to make sure that if there is a pull going from here, that this stuff that's happening in this in midline is not created from this area here, right? Take a deep breath and then exhale. So I'm just going to drag down this way. You okay with that? Is that too much? Okay. Inhale again and exhale. So as you're breathing in, basically all I'm trying to do is I'm just trying to hold that position rather than let the tissue go. So inhale again. Good. And then exhale. And I'm just dragging down on a diagonal this way to follow the ribs. Still tender there? Yeah. Is it tender on the other side too? Way more on that side. That's amazing. Drag your heels on the table just to lift your knees. Okay. And so you're going to push this way on your exhale. Okay. So inhale for me and then exhale. So feel a little bit better. Okay. Is there any kind of resounding sort of like pain in your back? Okay. So then to add with probably everything else that we're kind of doing, but I was thinking even like more lateral side of the leg, TFL, bleeding into like psoas work. So if it's, let's just say the right, so if it's your right side, I'm just gonna cradle the leg. I'm gonna work with like a little bit of like iliacus, but I'll kind of like go slowly into psoas. A good test for psoas would just be to lengthen your leg, and then if anything, you're gonna lift it up, and I'm gonna push it down on your exhale. Okay, inhale for me, and then exhale. How you doing there? Is that creating pain? Okay, but there's a little bit of weakness there, like I'm not able to hold it. Yeah. So if anything, what we'll do is we'll kind of like just wake it up and see if there's any kind of like restriction within, like let's just say the visceral area, that's hopefully not like combining itself with your external obliques. Okay. Okay. So inhale for me, and then exhale. So I'm just going to pin it down, and then I'm just going to check. Do you have knee issues on this side? No. Good. Okay. So I'm just bringing it into extension, and then taking it into internal rotation on your flexion, which is the opposite of what the muscle does, so that I can actually create a fascial pull. You okay with that? Is it too much? Good. So now I'm going to go a little bit more toward iliacus. You okay with that? Okay. Okay. I'll move up a touch. Inhale for me, and then exhale. Inhale again. Exhale. Okay. Can you relax that leg? Is there still a little bit of stuff there? A little bit. So then I would go back and I would do the same thing.